People are quite distressed, and I think this situation has touched everyone's nerve, particularly coming out of the Ebola period that we lived through, and that took us a long time to recover. We're just recovering from that, and we had the floods in September, and now we've been struck yet again with another tragedy. We're estimating that over a couple of thousand people are still displaced. That is the situation at the moment. The government is saying that now they're really overwhelmed and they need help. The other information we got really from the hospital is that there's some patients who are discharging themselves because of the smell at the hospital, and they're concerned that this is a health risk. So with regards to public health, we're really quite concerned. In some areas, there's been reports of bodies still floating in the water bodies, and we're concerned that obviously the decomposition within the next 24 to 48 hours could cause a public health risk. We have our own strategy in place. For example, we have non-food items that we're able to deploy or give out to the communities. We're able to go out there and support with regards to looking after children that may be displaced or families that are in need of immediate support. So in terms of assessment, we need to go and find out the number of families that are displaced, what they need, and how we can support them from our end. The plan is to set up child-friendly spaces where children will have a place where they can play, where at least they're given some emotional support, where they'll be provided with simple materials, small materials, such as books and crayons and paper to draw and write, just somewhere where they can feel safe and comfortable, really. So we'll be releasing money towards the emergency fund, and we're happy to say that we've got those resources at the moment available to be able to support government with their immediate needs. We need funding to go towards non-food items. So, for example, in the slum areas, we'll need shovels, we'll need barrels to be able to remove the debris. We'll need to be able to support families that are currently displaced. They'll need food, they'll need temporary shelter. If they need to go back to their homes, we need to be able to provide them at least with the basics for them to be able to start off immediately. Thank you very much for all the support you've given us. It's urgently needed to try and support families who have been displaced, to try and ensure that the children that have been that are part of families that are displaced are protected and secure the best way possible, to ensure that we can provide psychosocial support to these families that have been displaced, and even the funds will go towards at least trying to start up some communities or families where Save the Children is actually working at the moment.